Greetings, this is Dr. Nicholas Pennings. Welcome to Module 2 called The Health Risks of Smoking and Benefits of Cessation. Today we'll be discussing some of the health risks associated with smoking and some of the benefits that can be realized by quitting. Tobacco use remains the leading preventable cause of death, with over 435,000 deaths associated with tobacco use. Most of these are related to primary smoke, but secondhand smoke contributes an estimated 36,000 related deaths. This is followed by diet as being a second leading cause of preventable death, and distantly by a number of other causes. Well, the reason why that smoking poses such great health risks are the amount of chemicals that are produced through the process of smoking a cigarette. There are some 4,000 chemicals that are associated with smoking a cigarette that are produced either from the end of the cigarette or by inhaling and created through the burning process. You can see some of the more toxic agents that are listed here, including cadmium and toluene and ammonia. These are either added or created through the smoking process. These chemicals then trigger an inflammatory process in the body. As they absorb through the lungs, they migrate to the liver where they trigger inflammatory reactions. Inflammatory agents also contribute to the development of heart disease and affecting all parts of the vascular system, as well as an impact on muscle and related inflammatory conditions. Smoking affects most every part of the body, with the leading cause of death being associated with lung cancer. Lung cancer, though, is not the only cancer that's associated with smoking. Cancer of the oral pharynx and larynx, esophageal cancers, stomach cancer, pancreatic cancer, kidney cancer, bladder cancer, cervical cancer, and leukemia are all associated with smoking. We see here a diagram, an illustration describing lung cancer, as well as a chest x-ray which shows a lung mass, and CAT scan which shows a lung mass consistent with lung cancer. Second leading cause of disease related to smoking is ischemic heart disease. Stroke, peripheral vascular disease, and abdominal aortic aneurysm are also conditions associated. The heart attacks associated with smoking are brought about by changes of the lining of the blood vessel, causing inflammation and triggering clot formation, which will block an artery in the heart and the coronary artery, causing an acute coronary syndrome, or in a cerebral artery, causing a stroke. Other respiratory conditions like COPD are the third leading cause of death associated with smoking, but community-acquired pneumonias and exacerbations of asthma are other associated respiratory conditions. And we see here on chest x-ray the hyperinflation of the lung associated with chronic obstructive pulmonary disease and emphysema. Reproductive organs are affected by cigarette smoking. It is a leading cause of erectile dysfunction, but also reduces fertility, increases complications associated with pregnancy, causing low birth weight, and SIDS. I say sexual dysfunction is a common complaint among smokers. Other parts of the body are affected as well. Wound healing is affected through impairment of circulation and oxygenation of tissues. Smoking will affect bone density and increase risk for hip fractures, increase incidence of cataracts, peripheral peptic ulcer disease, and metabolic syndrome. The benefits of quitting smoking and remaining smoke-free are numerous. Benefits are seen as early as 24 hours with reductions in blood pressure and heart rate. We also see reductions of carbon monoxide levels in 48 hours, often returning to normal by that time. Over the first 2 to 12 weeks, circulation can improve, lung function will improve with improved breathing, gradually coughing will be reduced, and lungs will start to clear themselves out as the cilia that line the lungs help to remove debris from the lungs. At 1 year, the excess risk of coronary artery disease is cut in half for those that quit compared to smokers. And at 10 years, the risk of lung cancer is cut in half relative to continued smokers. At 15 years, the risk of stroke and heart disease related to smoking returns to that of a non-smoker. So in summary, smoking remains the leading cause of preventable death. Smoking impacts the health of every part of the body, and quitting smoking has both short-term and long-term benefits. Thank you.